There are many, many, many examples of the impact of ECHO. It's in Western Kenya, and it's around childhood cancers. The number of children that were being diagnosed with childhood cancers was, number one, way below the expected diagnosis based on the prevalence of childhood cancer. So that was one issue. And the second issue is that the diagnosis was happening too late. So the children would be treated for all manner of different things without getting a correct diagnosis. And so by educating, in this case it was doctors, by educating the doctors in those peripheral sites on how to recognize childhood cancer and accurately diagnose that in a child that comes to see them, by educating them on that, it became possible for them to accurately identify children who had cancer or who could potentially have had childhood cancer and refer them in an appropriate manner. The net effect of this is that, number one, it helped to increase the diagnosis and the referral of children with childhood cancer, and it made it possible for children to get diagnosed a lot earlier than was previously the case. So the first thing is that because of this, a lot of cancer cases that were being missed stopped being missed, number one. And number two, the cancer cases were caught a lot earlier. And the net effect was that many more children were diagnosed and started on treatment, and many lives were saved. And in fact, the figures that we have is that for every 2 children that got diagnosed, a life was saved that would otherwise not have been saved. Because many childhood cancers are curable when caught early, and these are children that end up getting cancer, becoming cancer-free, and living into adulthood without cancer. And this is something that's very important, because you can imagine the pain of losing a child to something that, if diagnosis had been done in a timely manner, would actually have the potential to be cured and to live into adulthood.